Top health officials are warning that the threat of COVID-19 is high for 32% of Americans right now, and that everyone in those communities should go back to wearing masks and avoiding crowds.
In areas where community levels are high, everyone should be using prevention measures and wearing a mask in public indoor settings. In areas with medium COVID-19 community levels in yellow, individuals should consider taking prevention measures based on their own risk, like avoiding crowds, wearing a mask, increasing their testing, especially before gathering with others indoors.
This comes as the 7-day average of hospital admissions from COVID-19 rose 19% over the previous week. Joining me now is Dr. Irwin Redlener, public health analyst and the founding director of the National Center for Disaster Preparedness. I feel like I'm having a little bit of deja vu, but I'm going to overcome it. Dr. Redlener, as we enter the first week of what I see as sort of like a proper surge without any mask mandates, what's your reaction to the CDC encouraging masks without actually any political backing or mandate? I mean, is recommending it enough, or do we actually need mandates?
Well, hi, Zerlina. Well, the problem is, even if CDC and the administration wanted to mandate the use of masks or mandate vaccinations to get into places, for example, there's really a great deal of difficulty in actually mandating these days because of legal rulings and tremendous pushback, and because the whole conversation has gotten politically poisoned, Zerlina. You know, you can't say anything hardly about mandating masks or even requiring masks without it becoming an issue that could have political ramifications for the midterms. That said, the other challenge is that this is an ever-changing situation. With every new variant, there are other things to worry about, and every new variant seems to be more contagious than the previous one. And what we're worried about is that at some point, we'll see a variant pop up that resists people's immunity that they've gotten either through vaccination or through having had the illness, or both. So it's a very complicated situation. We've been talking about this for a long time, and I think the point still holds that as much as we don't like to, we have to get used to accepting the uncertainty and therefore what may seem like ever-changing guidelines that are coming out of the CDC, as I said, really polluted by the political considerations at this point.
I mean, I just keep my mask on. I just never took it off. I feel like that was my best guidance, was just like, keep this mask on my face, because I don't know. I don't trust that people are vaccinated when they say that they are. People are getting fake cards. There were reports of that. So yeah. I just kept the mask on the whole pandemic. I want to talk about the subvariants, because you mentioned, you mentioned just a moment ago that the virus is changing, and these subvariants specifically seem to be behaving differently than any of the variants we've seen before. Can you help us understand what is different, why this mutation in BA2.1.2 and 4 and 5, I think I'm getting the numbers right, why this mutation is different than the other variants we've seen previously?
So when a new form of the virus turns out to have different clinical patterns, different impact on people, it gets to be called a subvariant. And in this case, several things are happening and can be happening going forward. Number one is that the virus can acquire in the new subvariant the ability to be transmitted much more quickly. Secondly, some of the variants will be more prone to just staying in the upper respiratory tract, that is your nose and mouth and throat, while others, the older variants that were much more dangerous, can settle down into your lungs. And that's where people get really, really sick. You can still get sick from any of the variants, and that's why the hospitalizations are rising. But what was killing people in great numbers was the form of the virus that would get down into the lungs and cause a severe pneumonia and difficulty getting oxygen into your bloodstream. So those are two of the problems. But the other thing that I am most concerned about, that I was mentioning before, is that what happens if a variant is completely resistant to the immunity that you've received from having been vaccinated in the past. That would be a situation of very significant concern, but fortunately we're not there yet. And by the way, the possibility of such dangerous vaccine evading variants can be reduced by having more and more people vaccinated, so we don't allow those overgrowths of the really bad forms to bother us.
Dr. Erwin Medlener, thank you as always for helping us survive this pandemic. We're all just taking it one day at a time. And again, as you said, good advice. Just, try to pace yourself in terms of the ever-changing nature of the pandemic. Please stay safe. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.